Health insurance. Just saying those two words can be enough to make your head spin. It's this huge system we all pay into, but let's be honest, very few of us feel like we actually understand it. Well, today, we're going to change all that. We are going to pull back the curtain on the 5 key terms that are the absolute foundation of every health plan out there, so you can finally feel in control.
But first, let me ask you something. If I asked you right now to explain what a deductible is, like really explain it, could you do it with 100% confidence? Hey, if you're hesitating even for a second, you are definitely not alone. And that little bit of uncertainty, that's exactly what we're here to clear up.
And here is why this is so important. That number, $13,000. That's about how much Americans spend per person on healthcare every single year. We are spending a ton of money on something where the basic rules are a total mystery. And that gap in what we know, man, it costs us. It leads to the surprise bills we all dread and can trick us into picking the wrong plan year after year.
So, let's build your foundation. The best way to think about health insurance is like it's a game. And to play any game well, or, at least not lose badly, you've got to know the rules. These 5 terms, they are the absolute rules of the game. Once you get these down, everything else just starts to click into place. I promise.
Okay, first up, the premium. This one's the easy one, thank goodness. Think of it just like your Netflix or Spotify subscription. It's the flat fee you pay every single month just to keep your membership active. Doesn't matter if you go to the doctor 20 times or not at all, you pay the premium. It's the cost of entry.
So what does that actually look like? Well, for someone getting insurance through their job, the average they paid out of their own pocket was about $1,400 a year. Now, the good news here is that your employer is usually footing the much bigger part of the bill. We're talking 70, even 80% of the total cost.
All right, here we go, the big one, the deductible. This is probably the most misunderstood term in the entire health insurance universe. So let's make it simple. Your deductible is the amount of money you have to pay for your own medical care first, out of your own wallet, before your insurance company really starts to step in and share the costs. That before part is everything.
Here's a great way to think about it. Imagine your plan's best benefits are locked in a box. Your deductible is the key to that box. Every time you pay for a doctor's visit or prescription, you're paying to turn that key a little more. Once you've spent enough to meet your deductible, pop, the lock opens, and now your insurance company is ready to help you out in a big way. And to put a real-world number on that, back in 2023, the average deductible for a single person was about $1,735. So the typical person had to spend that much on their own before their insurance really kicked into high gear for the year. Next up, we have the copay, and thankfully, this one is much simpler. A copay is just a flat fee you pay for a specific service. Like that $20 for a checkup, or maybe $50 to see a specialist. It's predictable, it's what you pay at the front desk when you check in. Easy enough. Okay, so what happens after you've met that big deductible? You've unlocked the box. Now what? Well, now you enter the world of co-insurance. The key word here is co, as in you're cooperating. This isn't a flat fee, it's a percentage. It's the phase where you and your insurance company are literally splitting the bill. Let's make this super clear with an example. Say you have a pretty common 80-20 plan, and let's say you get a big $10,000 bill for a surgery after you've already met your deductible. With an 80-20 split, your insurance company pays 80%. That's $8,000. You're responsible for the other 20%, which is $2,000. That's co-insurance right there. Okay, so you might be thinking, what if something catastrophic happens? Is there a limit to how much I have to pay? Yes, thank goodness. It's called the out-of-pocket maximum, and it is your ultimate financial safety net. This number is the absolute, final, most you will ever have to pay for your healthcare in 1 year. It's literally what can save you from financial ruin after a major accident or illness. Everything you pay, your deductible, your copays, your coinsurance, it all adds up and counts toward this one magic number. For 2024, the federal government set that cap at $9,450 for an individual. Once you hit that number, you're done. You don't pay another penny for covered services. Your insurance company takes over and pays 100% for the rest of the year. It's the finish line for your spending. So you've got the 5 key terms down. But how do they all get bundled together into an actual plan you can choose? Well, that's where plan types come in. And when you're choosing one, it almost always boils down to one single fundamental trade-off. And here it is. This is the big choice you have to make. Are you somebody who wants to pay less every month in premiums, even if it means you have a smaller network of doctors and a few more rules to follow? Or are you willing to pay a higher monthly premium for the freedom and flexibility to see pretty much any doctor you want whenever you want?
So this basically breaks down into three main options. First, you have an HMO. These plans usually have the lowest monthly premiums, but the trade-off is you have to stay within their network of doctors and you need a referral to see a specialist. Then there's the PPO. This gives you the most choice, the most freedom, but you definitely pay for it with higher premiums. And finally, there's the HDHP, the high deductible health plan. It's got low premiums, a high deductible, and a very interesting superpower.
And that superpower is the ability to open something called a health savings account, or an HSA. Now, listen up, because this is a really powerful financial tool that is only available if you're enrolled in one of those high-deductible health plans. You can't get it with any other type of plan.
So what the heck is an HSA? Well, it's a special kind of savings account where you can stash money away just for medical expenses. But here's the kicker. It's not like a regular savings account at your bank. It comes with some really amazing tax advantages.
What makes the HSA so special is what financial nerds call the triple tax advantage. And believe me, this is incredibly rare. Okay, get this. First, the money you put into the account is tax deductible. That lowers your taxable income for the whole year. Second, that money can be invested, and it grows completely tax-free. And third, when you take money out to pay for a qualified medical cost, that is also tax-free. It's the reason some people call it a financial unicorn.
Okay, so now you know the terms, you know the different types of plans. How do you actually put all this knowledge to work when it's time to pick your health insurance? Let's walk through a super simple 5-step game plan you can use for your next open enrollment.
Step 1, just be real with yourself. How often do you think you'll actually go to the doctor this year? Step 2, do the real math. The true cost isn't just the monthly premium, it's the premium for all 12 months plus what you might have to pay for the deductible. Step 3, look at your savings account. If a surprise medical issue came up tomorrow, could you actually afford to pay that deductible without going into debt? Step 4 is crucial. Check the plan's network. Make sure the doctors and hospitals you trust are actually included. And finally, step 5, if you're eyeing an HDHP, see if your employer will kick in some cash to your HSA. I mean, that's free money.
And of course, just a quick disclaimer here, this is all for educational purposes. This is not professional, financial, or medical advice, so you should always talk to a qualified professional about your own specific needs.
I want to leave you with this one thought. The truly expensive health insurance plan isn't always the one with the highest premium. The most expensive plan is the one you don't understand. Because that confusion, that's what leads to costly mistakes and sometimes even avoiding care you need. In the world of insurance, clarity is your best policy.
So, there you have it. You know the rules of the game now. You understand all the pieces on the board. The next time you're looking at a list of health insurance options, you'll be able to choose with confidence. You're not just guessing anymore, you're making an informed decision. So the only question left is, what move are you going to make?